I think what was challenging is not actually having paper. That was more of the change that we needed to manage because we came from such a paper-intensive environment in terms of reviewing prescriptions or paper charts. The iPad in the hands of a clinical pharmacist was really powerful in terms of giving them so much access to patient information that they had never previously had. It empowered them better on ward rounds with doctors or microbiologists, so that at the click of the button they had all the necessary information they needed in terms of laboratory results, up-to-date medication therapy, how the patient may be responding, to really just guide and advise better medication management and therapy for the patients. So it really helped empower them to contribute more confidently and better within the multidisciplinary team. I think the iPad was selected mostly because of its advantages that it provided in terms of mobility within the hospital setting, that people weren't fixed to a station, that it was not so heavy, people could carry it quite easily and move from one patient to another. They're also easy to use, they're easy to navigate, and everyone was kind of familiar with the tool itself. It's really provided an amazing platform for our pharmacists that we never previously had exposure to before. There was no healthcare professional within our hospital network that was left untouched by the system.